Good afternoon, everyone, and welcome to Components of a Winning Program, Health Plans Perspectives on EPA's National Environmental Leadership Award, a webinar hosted by America's Health Insurance Plans in conjunction with the U.S. Environmental Protection Agency. I'd like to thank everyone for joining us today. My name is Chris Riegel, and I'm a Senior Health Research Associate with AHIP, and I will be moderating today's discussion. Next slide, please. Before we begin, I just want to highlight a few housekeeping notes. We ask that all attendees please place your phone lines on mute. For this webinar, we will also be using a chat feature in the webinar for questions. Questions will be addressed throughout the webinar, as well as at the end of the presentations. Polling questions will be conducted during the webinar, and we ask that you please participate. And finally, slides will be posted after the webinar at ahip.org/asthma, where you can find other asthma-related resources and past webinars. Next slide, please. Today's webinar is about the health plan perspective on the EPA's National Environmental Leadership Award. We want to provide webinar participants with information on the application and the process, and we want to educate participants on the value of the award. We will also discuss challenges to applying for the award and offer recommendations for addressing these challenges. Finally, we want this webinar to serve as a resource for anyone interested in applying for the award. Next slide, please. We also want to call attention to a brand new series of videos that AHIP has produced as part of the Asthma Project. The 3 videos we produced will cover the value of the EPA award, featuring health plans and community organizations discussing how the award has helped them gain national recognition of their programs. The second video is a discussion of asthma management programs coming from those who have established and implemented them, with talk of sustainability. And the third video discusses the value of partnerships and collaborations across health plans and community partners. These videos will be shared on ahip.org/asthma, and a link to the award-specific video will be provided in the chat function today. Next slide, please. So as mentioned, we have some polling questions today, and the first question is, which option best describes your organization? So as you can see from our early results, about 1/3 of our participants are health insurance plans. We appreciate you joining us. And we also have representation from private companies other than health plans, about 20% in community-based organizations, 15% government agencies, and 1/4 of our attendees are other. Thank you for responding. Our second poll question is, if you are not a health insurance plan, does your organization currently partner with any health plans to deliver asthma management services? So about 1/3 of those who responded, 30%, indicated that they do work with health plans for asthma management services. And 22% of those who don't say that they're interested. I think those are really great numbers, especially for this audience. Our third polling question is, where did you learn about the EPA Leadership in Environmental Asthma Management Award? The majority of our participants came from email notification or the AsthmaCommunityNetwork.org, which is great. We have 8% from the ahip.org/asthma and 4% from the EPA, and about 1 in 5 came from another source. And finally, most specific to this webinar, does your organization plan to apply for the award? Great, great. We have about 21% saying they will, and about 60% that aren't sure. Excuse me. And for those who aren't sure, hopefully this presentation will help clear up some questions and encourage you to apply for the award. It has some great benefits. And thank you all for your responses. Next slide, please. Our first speaker today is Tracy Mitchell of the EPA's Indoor Environments Division to tell us about the National Environmental Leadership Award in Asthma Management.
Good afternoon, everyone. Thanks, Chris. I'd like to start by saying a thank you to Chris and his colleagues at AHIP for the work that they're doing to promote and support the best practices across comprehensive asthma management through health plans and other organizations. I'm pleased to be here on behalf of EPA to tell you about this National Recognition Program and to encourage you to apply. I'd like to give a special thank you to Karen Meyerson and Karen Michael, the two speakers you're going to hear from. I really appreciate their willingness to share their perspectives as previous award winners and for their eagerness to impart the knowledge and experience regarding their asthma programs. They have a lot of really great information to share. Next slide. Before we get into the meat of the presentations, I want to start by giving you just a little bit of background on the National Environmental Leadership Award. EPA started this award in 2005, and since then we have continued to surface best practices by awarding up to, in 3 categories, 38 awardees. The 3 categories are health plans, healthcare providers, and communities in action. Today we're focused on our 2 winners will focus on the health plan category, but as we see from the variety of stakeholders who are on the call, we all realize it takes coordination and cooperation from many partners and organizations to deliver comprehensive asthma care, hence the 3 categories. And many of the categories, even though a health plan is the primary recipient, often they're partnering with the community organization, or a healthcare provider is being reimbursed by a health plan. So as you see, there's a lot of overlap in these categories, but we're excited to focus on health plans today. Next slide, please. Today, we will hear from AmeriHealth Caritas and Priority Health, who are among several of our health plan winners, and you see the previous recipients on the screen right now. They represent plans from across the country. They represent different size plans, and they represent different programs that have different approaches but share a common goal of supporting the delivery and sustainability of asthma care that realizes cost savings and achieves positive health outcomes. Next slide, please. So these programs have demonstrated what it takes to win the award, and as you see, these are some of the key components to winning the National Environmental Leadership Award. If your program embodies a system for delivering high-quality asthma care that includes what we've identified as 5 key drivers of care, and this includes having strong community ties, having committed leaders and champions, working with high-performing collaborations, serving and delivering integrated healthcare services, and of course, having tailored environmental interventions as a key component. Also, if your program is grounded in science, in the NAPP guidelines, which also include a robust environmental component in those national guidelines. Ultimately, we're looking for programs who are achieving health outcomes and return on investment or financial savings. Next slide, please. So again, as you decide whether to apply for this national recognition, consider the components of your program that address the application criteria and especially demonstrate success in improving health outcomes and the bottom line. Your application will be reviewed by 2 panels of experts, including asthma champions from EPA, CDC, the Centers for Disease Control, National Institutes of Health, HUD, Housing and Urban Development, nonprofit organizations, and previous winners. These panels of experts review each application based on the criteria and make the recommendation for this year's winners. Next slide, please. If chosen as an award winner, you'll be highlighted and placed in our Hall of Fame. This is on Asthma Community Network. This is where we feature the 38 previous award winners. And you would join this distinguished group of programs. Each program receives an engraved crystal to display in your organization. The announcement of the award winners and promotion of your program typically takes place, and we're planning to announce in May during Asthma Awareness Month. We use that as a great venue for getting for raising awareness and for getting visibility for our award winners. recognition on Asthma Community Network, on EPA's website, as well as through media and press kits, and an opportunity to share your program successes through webinars like this, through speaking at national conferences, and by serving as mentors to other programs across the country. These are all benefits that come with winning the award. So now let's hear from today's speakers with more details about their programs and what it takes to win the award. I'll turn it back over to Chris.
Great, thank you, Tracy. Our next speaker, as you can see on the screen, is Karen Meyerson, the Director of Commercial Care Management for Priority Health. Priority Health was the recipient of the Leadership Award in 2007, and Karen can provide some insight into their winning program and the value of the award. So take it away, Karen.
Great. Thank you, Chris, and good afternoon, everyone, and thank you for this opportunity to talk about Priority Health and the national award that was won 10 years ago now. It seems amazing, but I'm delighted to talk about that. This is our contact information, and I want to just provide a little bit of background as well. When we go through the slides, I came to Priority Health 4 months ago after serving 20 years as the manager of the Asthma Network of West Michigan, which won the National Leadership Award on the provider side of it. So using both perspectives, I would like to address this now, that Priority Health approaches healthcare differently. While most insurance companies focus on processing claims, which is what we do as well, we also work closely with our customers to ensure that they receive the right care at the right time in the right place. And we were created 30 years ago by a group of physicians and hospitals who wanted to ensure that the community they served could afford access to quality care. So we are a nonprofit health plan. We operate efficiently on behalf of our customers. We spend 90 cents of every dollar on our customers' medical care, and there aren't many health plans that can say that, so we're very proud of that fact. We're leading the industry with our work to pull back the curtain on healthcare costs with one-of-a-kind tools that help our customers shop for care. One of those examples is our transparency tool, where members can go online to the member portal. They can search for green facilities, and in this case, with all respect to the EPA, green facilities in our case mean lowest cost facilities and not necessarily environmentally friendly facilities, but they can find these green facilities for the most commonly searched procedures. And if they choose a green facility, then they are given a rewards card. They can also go online and look at what their out-of-pocket costs will be for anything from prescriptions to procedures as well, and they can determine where they want to receive care. So these transparency tools are fairly new and innovative. We cover 750,000 lives. We are a regional plan, so in the state of Michigan. We have all three products, commercial, Medicare, and Medicaid. Commercial is our largest book of business, about 500,000 covered lives. Of those, about 100,000 are individuals who have purchased our health care through the Affordable Care Act. Medicare and Medicaid just about split the difference of the other 250,000 covered lives. Next slide, please. So our hard work is being recognized. We have a long history of providing progressive products, smart programs. We want to keep our healthcare costs down and provide the best care possible to our community and keep our community healthy. We've been named among the nation's best health plans by the NCQA. We were the first in the industry to reward physicians for quality care through our physician improvement incentives. We lead the industry in revealing healthcare costs. I mentioned the transparency tool, among others. 9 out of 10 people would recommend Priority Health to their family or friends. So from the myriad of health and chronic disease management support that we provide our team, to our customers, to the wealth of resources that we provide to our community, we are striving to improve the health and the lives of the communities in which we live and we work. Next slide, please. So our successful collaboration goes back to the Asthma Network of West Michigan, and that is the grassroots asthma coalition that I helped develop and manage for 20 years. The Asthma Network of West Michigan began in 1996, and after 3 years of successful home-based case management, approached Priority Health and asked them if they would be interested at that time in reimbursing the Asthma Network for those services. So in 1999, Priority Health partnered with the Asthma Network of West Michigan, developed a contract, and it was the first ever contract between a health plan and a grassroots asthma coalition in the nation. and we've been paying the Asthma Network ever since for those services. And this partnership underscores the value of the Asthma Network services and Priority Health's commitment to its members. So the Priority Health reimburses the Asthma Network for home-based asthma case management to Priority Health members with asthma, both Medicaid as well as commercial, and now even Medicare members with COPD or asthma as well. The reimbursement is for services that are provided by nurses at the RN level, or respiratory therapists at the RRT level, or licensed master's level social workers. All of them are certified asthma educators, or they must become certified asthma educators within a year of employment. And they provide home visits for these individuals in 3 West Michigan counties. They visit the families, they follow them for anywhere from 3 to 6 to 9 months, sometimes up to a year, depending on the acuity and the degree of severity of asthma and other comorbid conditions, as well as social determinants of health. The care managers really provide a holistic approach where they identify not only asthma itself and triggers that might be affecting that individual, but also other competing priorities that might impact that family's ability to optimally manage asthma. So the care managers also go into the schools and conduct a school visit, so they ensure that the school staff know how to manage asthma in that setting and have an asthma action plan on hand, know how to use the inhalers. They also accompany the families to care conferences with obviously permission of the provider and the family, just to listen in, and they're also able to reinforce those messages that the families are hearing during these asthma visits. All of these types of visits are reimbursed by Priority Health, and the reimbursement for home-based case management has been able to demonstrate ROI, return on investment, as well as value on investment. Next slide, please. So the National Leadership Award, which was awarded, as I said, in 2007, which was now 10 years ago, and the Asthma Network won the award on the provider side the very next year in 2008. But those awards have been able to elevate both organizations. That is the opportunity to really promote this innovation that is taking place in chronic disease management, such as asthma. It allows us to share our risk stratification, how we utilize and leverage those community partnerships. We also demonstrate and are able to share some clinical and financial outcomes, as well as our payment strategies. We were able to obtain this national recognition by the U.S. EPA. And we also do a considerable amount of networking, not only on the provider side through the Asthma Network, but also on the payer side with other communities around the nation that are doing similar type of work. And the EPA has been very successful in mobilizing 1,000 communities who are working for individuals who have asthma. It has also been a springboard for greater visibility in asthma management best practices, and it's been an impetus for other program development, such as COPD. So Priority Health approached the Asthma Network about 2-3 years ago and said, you know, we love what you're doing for our members with asthma. We know that members who have COPD would also benefit from this in-home case management, education, support, holistic approach. Would you consider adapting your program and serve our members with COPD as well? So the Asthma Network took that under advisement and then created a COPD in-home case management model predicated on the asthma model, tweaked it a bit. The staff members continued to receive training in COPD and COPD management, and there's no national certification for that, but there are several courses for COPD educators, and they have been able to provide these services and bring great value to our members with COPD as well. Next slide. Thank you very much for your time and attention. Be happy to answer any questions you have.
Great. Thank you, Karen. That was great. Our next speaker up is Karen Michael, the Vice President of Corporate Medical Management for AmeriHealth Caritas, which won the 2016 Leadership Award. Karen, go ahead.
Thank you, Chris. AmeriHealth Caritas serves over 5.3 million members, and the majority of those are in managed Medicaid health plan business. We also have 2 Medicare D-SNP plans, dual eligible special needs, and 2 Medicare Medicaid demonstration programs. in addition to our wholly owned pharmacy benefit management and behavioral health managed care companies. Our Medicaid health plans operate in 6 states and the District of Columbia, and among that population, asthma is definitely the highest volume chronic condition that we see in our members. I'm going to go to the next slide, Chris. The main key to our program is that there's really no one initiative or approach that we have found to be effective. The results that and program components that we pulled into our comprehensive approach to asthma were largely piloted in our Philadelphia market, where we've got a high incidence of asthma, and with the poverty and the living conditions in some of the residences in Philadelphia, a lot of environmental triggers that exacerbate and hinder a family's ability to control a child's asthma. So we really took a very continuum-based approach going across the community, schools, provider offices, and then also involving the enterprise in setting goals. On the community front, we partner with community health workers. We both partner and employ community health workers. So depending on the organization that we're working with, some of the provider offices, we actually fund a position for them. In other offices, we provide the actual FTE resource in the office to do home visits and follow-up for our members with asthma that are seen in that office. As part of that home environmental assessment, we're able to provide remediation kits, mattress covers, disinfectants that can help families who have an asthmatic child in the home, as well as get a full picture of the different triggers that might be present in the home and not discussed in the physician's office. So finding out about the secondhand smoke, about the 2 cats that are kept in the bedroom next door. We also work in the schools with the school-based clinics and change some of our policies to support our asthma work, including the policy around inhaler refills, making sure that children have the ability to get 2 inhalers so that they can keep one at school and one at home. On the community front, we hold asthma edutainment programs, and the most notable of those is our Healthy Hoops program, which combines asthma education with a basketball clinic. We bring in local celebrities to provide clinic drills and basketball technique education while we're concomitantly providing education to those children around the importance of maintaining their controller medication, how to exercise, and still keep your asthma controlled, working with families in separate clinics and workshops during that day-long program to provide them with that education on action plans and triggers. Every child coming through gets a complete assessment, including pulmonary function testing, and if necessary, referral to a physician on site. They all leave with an asthma action plan that's either developed in conjunction with their current physician or developed on site for them to bring and discuss with their physician in a follow-up appointment. In the provider offices, one of the things that we found as a limiting factor was the disconnect that happened when a child was started on an asthma medication or an inhaler or needed equipment to more effectively use the inhaler and had to leave and go to a pharmacy, and maybe they got some instruction in the office on what to do, but it wasn't on their inhaler and their equipment. So when they got the equipment from the pharmacy, they often had to come back for additional instruction. We provided dispensing cabinets for asthma medication in physician offices so that the physician could dispense the medication and the spacer or whatever other equipment was needed right there and provide that education before the child left the office. And then the other piece that I really wanted to emphasize was the focus that the organization put on asthma as a whole. Since 2013, we have had an annual enterprise goal that has focused on one or more aspects of asthma management. The first year we started focusing on what we call failure events, which were an admission for diagnosis of asthma. So looking at conditions like asthma that could be managed in the community and could be managed in an ambulatory setting that should not result in an admission where the primary driver of that admission is an exacerbation. We also looked at medication adherence among our asthmatic population and set an enterprise goal the following year to increase medication adherence. We looked at readmission rates for members with asthma in the third year. So every year we picked a different element to focus on as an organization and to come up with and put plans in place to enhance our current program to impact that particular goal for the year. Can we go to the next slide? When we first started looking at this award, we weren't sure that we were equipped to apply for it, and I'll be upfront with you about that. But we took a step back and looked at everything we were doing and pulled together the resources across the organization from our community education, our public affairs department, our provider network area, our regional chief medical officers. And when we pulled everything together and took a look at the body of work in total, we did believe that we had enough to be successful. And as you can see, we were successful in winning the award. And the award has helped us as an organization, not only from the outside recognition and being able to share that information with our potential or renewing customers, but also internally, because it gives the staff validation that what we're doing to impact the lives of our members, to help them get care, stay well, and build healthy communities is not just something that we do because we know it's the right thing to do, but that there's external validation that this is making a difference for people. Since we've won the award, we have continued to scale out our current programs, take components of them and bring them to other markets. So our BEST initiative, which involves the provider office dispensing for the asthma medications and equipment, has now expanded to 2 other markets within our family of companies. Our community health worker programs likewise have expanded across our different health plans in the country. We were also fortunate to participate in AHIP's Leadership Roundtable as one of the external recognitions of winning the award. Next slide, please.
Thank you very much, Karen.
I'll be happy to take any questions as well.
Great. Thank you, Karen. I also just want to point out that roundtable report that Karen referenced can be found right on the front page at ahip.org/asthma. It was a really good report, I thought, and hopefully you can read it and gain some insight into the plans we spoke today, as well as some of the other plans. Now we will go back to Tracy Mitchell for some more information from the EPA.
Great, thank you, Chris. And I'll just say thanks again to Karen and Karen. I think they both are great at describing their programs, and you hear from one program who won 10 years ago. They've been able to sustain their program over time and been able to use this award to, as Karen said, develop and begin work in another disease entity, COPD, and model similar components of their asthma program. So it's really exciting to hear how they have evolved and used this award to enhance their program and start a new program. And then you hear from Karen Michael, who you know, is a more previous winner just last year, more recent winner, I should say, and how they've been able to leverage the award, again, to expand into, I heard her say, expand into 2 other markets, and to really promote the work that they're doing throughout their organization. So this is very exciting. We look forward to hearing from Karen Michael in 10 years as their program evolves over time. So as you see on the slide, hopefully what you heard from both of these programs excites you about applying and helps you think about how you could tell your story. If you need help, though, there are resources to help, and we want to help you. There are sample applications on the website for the award. So specifically, here's the link to the health plan application, but again, there's a sample for the community category as well as the healthcare provider category. I really want to encourage you, if you're considering applying, to visit the Hall of Fame on AsthmaCommunityNetwork.org. This is where you'll be able to read about all of the previous award winners and kind of see in a snapshot the components of their program, what made them award winners. Again, the award is over 10 years old, so programs have evolved. The award has evolved a little bit, but the primary and kind of the key components haven't changed. So you'll be able to see those key components reflected in all of our previous award winners. I mentioned again the change package, those 5 key components: high-performing collaborations, champions and leaders. Those are kind of elaborated on and spelled out in our asthma change package. You have the link there. And again, everything that we do and all of the science around asthma is grounded in the NIH's NAPP national guidelines. So there's a link there for your reference in case you need that as a reference. Next slide, please. We're going to take some questions, but before we do that, based on what you heard after participating and hearing from our 2 speakers, does your organization, does this change your mind about applying for the award? So about a quarter of you sounds like you heard things that make you more apt to apply. Over half of you are still not sure. So hopefully we have some questions that have come in through the chat function. We'll go ahead and answer some questions. You have my number and email that was given at the top of the presentation. You have Chris's information. Any of us are able to answer questions. We can't answer specifics about the, your program and the application, but we'll try to give you as much information and as much help as we can so that you can decide if it's a good fit for your organization and whether or not to apply. Chris, I think if you want to go ahead and start addressing some of the questions we've received.
Sure. Actually, right before we do that, I just want to let everybody know that the deadline for applications is 11:59 p.m. on February 1st. So if you plan on applying, please get your applications in before then. And yes, let's answer some questions from the audience. So first question was asked was to either or both of our speakers. What made you decide to apply for the award, and how did you know your health plan was ready or qualified?
Hi, this is Karen Michael. So, as I said, we had looked at it the year prior, and as we were, I think, a little too late looking at it that year, so we really weren't able to pull enough together. But we set out to make sure we would be ready for the next application cycle, and we knew we were ready when we were able to map all of our current program components to the different pieces that were in the application with respect to community involvement, partnerships, working across the continuum of care, having an integrated care management approach. So really we used the application to help us more or less as a checklist to understand whether or not we had what it would take to apply for the award.
And this is Karen Meyerson, and this goes back again 10, probably 11 years. When I was with the Asthma Network, which won in 2006 a Model Program Award as a result of our collaboration with Priority Health, and that elevated both of the organizations. And as a result of that, Priority Health did apply in 2007 because of that unique, innovative relationship where they were the first payer in the nation to reimburse for those home-based case management services. It had never happened before, as far as we were aware. And because of that, the Asthma Network has been able to engage in contracts with 4 other health plans. So it really has enabled the Asthma Network to be sustained for 20 years. And Priority Health has seen tremendous benefits from that collaboration as well.
Great. Thank you very much. This question is specific for, I believe Karen Michael said it. You mentioned offering disinfectants to clients during your home visits. What type of disinfectants do you provide?
It's a part of an asthma control kit, and I truthfully, if you send me an email, I'd be happy to find out the answer, and I just don't know it off the top of my head. I'd have to go to look at the contents of the kit.
Thank you. Another question from the forum is, can a community health worker be reimbursed for home visits in Massachusetts? are there resources to find this state by state? I can actually answer this one. There are resources available on AsthmaCommunityNetwork.org, and these are constantly being updated. So I would direct you to the Network Financing In-Home Asthma Care page for resources on their state website. Next up, is the award eligible for Canadian companies? Tracy, I will throw that one to you.
Okay, great, thank you. Unfortunately, no. On the eligibility page of the award, it goes specifically who's eligible, and unfortunately, folks out of the country, out of the United States, are not eligible to apply at this time.
Great. And Tracy, sticking with some more application-specific questions, can school districts apply, and can for-profit groups apply?
Good question, yes. School districts can apply. Again, look at the criteria, and if you have an asthma management program that's either district-wide or involves several schools, absolutely you would be eligible. For-profits, many health plans are for-profit entities, and so yes, they would be eligible to apply as well.
Great. Another question came in from the audience. Many health plans are very large and at the national or regional level, but the asthma programs are often specific to a state or community. How do you recommend we best describe the relationship in the application? Should we focus on the larger scale or on the smaller components specific to the asthma program? Tracy, being the application expert, that may be for you.
Well, actually, I'd like to punt it to Karen Michael first,
sure.
because she, is a great example. Her health plan covers 6 states and has many different components, and so if she wouldn't mind taking this, and then I'll jump in afterwards.
No, not at all. But Chris, just read it to me one more time.
Sure. So in the application process, this questioner is curious if they should focus on the larger scale or on the smaller scale components specific to an asthma program when they have a large and/or national program.
Yeah, we actually use a combination of both. So we've got some components of the program that we included in the application that are very large scale, like our data mining and care gaps and outreach for asthma medication refill, and some that are very small scale, such as the home visit component and the community health worker piece. So I would actually encourage you to present it as a balanced portfolio, because it's really about making sure that members with different needs are getting services that meet those particular needs. So describing the intervention, the populations it's targeting, and then the impact that intervention had for both sets of interventions, large scale and small scale, I think is helpful.
Mm-hmm.
Right.
And
I'm not the reviewer of the application.
Sure.
And this is Karen Meyerson, and with Priority Health, while there are pockets of reimbursement throughout the state, Priority Health reimburses the Asthma Network, obviously in West Michigan, but there's also a robust team of telephonic care managers who serve members throughout the state. So they are doing care management for individuals with asthma throughout the state. And when there are areas where there are home-based components, it is a very closely tied team where the individuals go into the home and provide those services. And when the family graduates or when that case is closed, then there's a warm handoff to the telephonic care managers. So I would agree. I would do both larger and smaller scale.
Great. And another question just to both speakers is, if you had one piece of advice for tackling the application, what would it be?
Again, this is Karen. I would say really just making sure that you very clearly map what the application is asking for to the answer and text you're providing, because the space is a little limited. So you want to make sure that you're making your points early and up front, and that you're hitting every piece, every component that the application is looking for.
Yes, and I would agree, and just do your research ahead of time, and make sure that you have the statistics at your fingertips and any facts that you might need as well.
Great. Let's jump to another question, and that's great answers and very helpful, I'm sure, to the listeners. Another plan asked, if we are still working on outcomes and ROI data, can we apply for the award, or should we wait until we have the results before applying?
Hi, this is Tracy. I'll go ahead and take that question. I think the stronger applications are able to demonstrate health outcomes and return on investment. We have had applicants who are kind of in process who have applied, and I can't speak for them, but I think it's a good experience to apply even if your program's maybe not quite ready. And we've had applicants, what we do after the competition and the panel's review is we will give you feedback on your application. And we have had applicants who have taken that feedback to heart, have resubmitted, and have been winners of the following year or several years out. So I don't want to discourage anyone from applying. If you feel like you are at a good place to apply, if you do have data to support your outcomes and are able to demonstrate and address the criteria in the application, I'd encourage you to apply. We recognize that it is labor intensive, it is, it can be somewhat daunting. We have taken that feedback from previous years. We've tried to consolidate, but again, this is really the highest honor, the highest recognition in the country for asthma programs, and so we feel like it needs to be a rigorous and competitive application and a rigorous and competitive process in order to maintain the integrity. So having said that, I hope I'm not discouraging you. I hope I'm encouraging you and exciting you about being a potential winner.
Great. We had a question regarding outdoor and indoor environmental triggers, or do you focus mostly on in-home asthma interventions? The plans featured today were about some of the environmental triggers, and does the award focus mostly on in-home asthma interventions? Tracy?
That's a great question. We know that people spend 90% of their time indoors, and I work in the Indoor Environments Division, so that is a key part of the award, and we know that that's a significant contribution to asthma or indoor triggers. But there, in the criteria, it does ask if you address outdoor air quality or outdoor, potentially outdoor triggers. And one of our reviewers is from our Office of Atmospheric Programs, the outdoor air folks. So, we're always looking for comprehensive programs. We're looking for programs that address all triggers as much as possible. And so I think if you are addressing both indoor and outdoor, it's a great thing to let us know. And if you're specifically doing, conducting either your organization or partnering with an organization who's conducting in-home assessments and in-home remediation, that's really a key part of the criteria as well.
Great. And one question for the presenters, that this one may be a little stray from the award, but how do you think changes to the ACA will impact the sources of funding for in-home asthma care? Will health plans still be willing to reimburse for asthma management services?
And this is Karen Meyerson. I can only speak to the fact that Priority Health has reimbursed for these types of services, as I said, for almost 18 years. So I don't anticipate that changing if the ACA does change. It was in place before the ACA went into effect, and I'm sure it will continue to remain in effect.
Great.
And this is Karen Michael. I wouldn't see any changes in our reimbursement or projects around community health workers or any of our reimbursement for the community partners changing based on the ACA.
Yes.
Great. Let me see, the questions keep coming in. If you do have any questions, please send them over, and we will try and answer them. Next, sorry, go ahead.
And Chris, this is Karen Meyerson. I just wanted to mention something too about community health workers. There was a question that came through about them. I can't speak to reimbursement for CHWs, but I am on the Asthma Educator Certification Board, and CHWs can become certified as asthma educators. Typically, you would need to have a credentialed health professional who would sit for the exam, but a CHW or an MA could sit for the exam if they can demonstrate 1,000 hours of patient-level asthma education experience. So that is something else for programs to consider, because health plans are asking for that for their the individuals who are providing these services to have the highest credential that is possible, and that in this instance that would be a certified asthma educator. So CHWs can become certified as well.
Great, and similar question, do you know if there are any partnering opportunities for indoor air quality inspectors in the program? Tracy, that one may be for you.
That's a good question. I think I would refer you to our regional EPA offices. They may be able to connect you with someone if you're looking for, I don't know if you're looking for a private company or if the question is addressing if the EPA does inspections, but we do have EPA does have 10 regional offices across the country. You could go to EPA.gov and search for regional offices, and that would list which region you fall in by state, and you may be able to contact them if you're interested in finding out about specific inspections.
Great, thank you. Again, I urge if anybody has any last questions to please send them in. I have one more that was submitted. Earlier in the presentation, there were participants who indicated that they are not currently working with a health plan but would like to. Is there a way to get a list of these organizations?
We typically don't publicize the list of participants. If someone has a specific request, if you'd like to email us or even through AsthmaCommunityNetwork.org, you could search for programs in your area, whether it's a health plan or other asthma programs. You could connect with us through Asthma Community Network, and we could connect you with a mentor, as we mentioned earlier, not just health plans or mentors, but other programs, other award winners have served as mentors. So I think there are ways where we can help you make connections. It wouldn't be through necessarily just publishing the participant list.
Great. Thank you for clearing that up. That appears to be the last question in the queue. I'll give it another minute in case any ones come in just before the deadline. But again, I want to call your attention to the application deadline. It's February 1st, 11:59 p.m. We hope this webinar was helpful and that people have been encouraged to apply. As you can tell from our speakers today, there are some great opportunities to help people and be recognized by the EPA for your work. And I want to thank all of our presenters today, Karen Meyerson, Karen Michael, Tracy Mitchell. Thank you for your presentations. I think this was great and extremely helpful.
Thank you, Chris.
And it looks like we do not have any more questions in the queue. So with that, I think we will wrap up this webinar. This will be available again on ahip.org/asthma. Following the presentation, it will take a short period to get up, but it will be hosted there long term, as well as the aforementioned video series will appear on ahip.org/asthma. And I also encourage you to look at the chat functionality of this webinar for some very helpful links and resources. And again, thank you very much, and we appreciate your time, and good luck with your applications.